Hi, I'm Jonah Comstock, Editor-in-Chief of pharmaphorum. I'm here at JP Morgan at the beginning of day one at the Hotel Sparrow. I'm joined by Brad Bostic, CEO, Chairman, and Founder of HC1. Thanks for joining me, Brad.
Thanks so much for being here with me, Jonah. Appreciate it.
So tell me a little bit about HC1, what you guys do, and what you're here in San Francisco to accomplish this week.
Sure, yeah. Well, with HC1, we're really the leaders in transforming lab data into insights that improve outcomes for patients and also boost the bottom line for health systems that are clearly working on ways to do both of those things. So it's a great time to be part of what we're building because there's this awakening happening around the power of laboratory information, that it's the single most comprehensive type of data. If you look at it from birth all the way until death, you're constantly gathering lab information about individuals. But historically, that wasn't really viewed in a comprehensive longitudinal way. And now with these powerful artificial intelligence capabilities that we have, we can actually look at that information in a manner that's much more predictive, and we can prevent a lot of illness. And then ultimately help the patient journey connect all the way from the provider environment even into more of a clinical trial and research environment. Because if you think about it from a patient's perspective, when you're going through some type of care and you hit the end of conventional treatment, wouldn't it be great to just automatically have that flow right into more of a clinical research environment? So that's really what HC1 is all about.
Yeah, I mean, lab data historically has been very siloed, right? I mean, the lab companies themselves don't really store it in a way that's friendly to this sort of longitudinal analysis and insight, and then it lives in the electronic health records, and we all know how clunky those are. How do you take that data and sort of even just bring it together to something you can analyze?
Yeah, well, I had been working in healthcare data for a couple of decades, actually, and started to realize that every time there was a conversation about these data sets and how you could do better for patients, it was consistently the case that laboratory information was being used to diagnose more than anything else. But it was also clear that on the laboratory side, they're very focused on efficiency and quality, as they should be, but it was never on that longitudinal view. It was, how do I generate a result at a point in time for a doctor or a clinician to make some type of care decision. And then on the physician side, if you think about it, on average, it's, I think, about 7 minutes is how long a doctor has to spend with a patient. And so that's not enough time to look comprehensively at your historical trends. And so ultimately, it just isn't the way that healthcare was designed. It was to make it longitudinal. It was all of this episodic at a moment in time, looking at a result, making a decision, deciding, do I give a medication or what's the care plan? And then that data would be logged in some kind of an archive, like you said, electronic health record, lab information system. And come to find, there was this opportunity to start constructing what we call a health matrix based on all that lab information, in which there's the ability to look at the relationships and behaviors and how this lab information over time allows you to do things like predict who's going to develop chronic kidney disease in advance, for example. Imagine if you could help get ahead of that and treat that so you don't have somebody go into a crashing state. And that's the kind of thing we're doing. Heck, we even have the ability now to provide a high confidence prediction of who's going to develop cognitive decline based on all kinds of lab information that historically you couldn't see those signals because it would take too much manpower. And with AI, we can do that.
It seems like a lot of different stakeholders would be interested in these insights. Certainly insurers, health systems, and then pharma is our audience. So how do the different, who are you kind of selling to? Who are you putting this information together for? And how are some of the different stakeholders ideally going to kind of benefit from this?
Sure. Well, first of all, we're a very mission-driven organization, which I feel like is the right way to build any healthcare business. And so with that, I mean, we're focused on measuring how many patients we positively impact in a given time frame. So we think about this year, how many millions of patients will we positively inform their diagnosis to help them get treated more effectively. Come to find, when you do that, there's all kinds of virtuous information that gets generated that's extremely valuable to a number of constituents. First of all, for the healthcare system, it gives you the ability to make outcomes better, which ultimately makes healthcare cost less. So if you're in a value-based care arrangement or you're starting to get into value-based care, this is really table stakes. We do a thing called lab stewardship, which is really an automated way to ensure that you're not over testing patients, but also that you're not missing tests that you should be running, which is huge. It's massive. Think about how many patients are never diagnosed and then they end up with some terrible illness. And that costs the healthcare system a lot. And obviously, there's a huge human toll that occurs. But if you look at that journey, we're also finding that we're helping to enable a collaborative effort between the provider side of healthcare and pharma to the benefit of the patient. Because as I said, you get to the end of your conventional journey, or you're somewhere in a set of patients that could benefit from a clinical trial or be part of research. It's historically been really tough to connect those dots. And my own experience when I was originally in healthcare technology consulting at Ernst & Young, my mom actually ended up shortly thereafter getting diagnosed with stage 4 cancer. And so I watched her go through exactly what I'm describing, where she exploited all the conventional therapies. And then it was, well, what's next? And it was a very siloed situation trying to traverse from the customary delivery of care over into more of a pharma environment. And so we think pharma and provider really should be more unified. It's all about serving patients, right? It's all about diagnosing and treating patients better. It's all about accelerating the delivery of new treatments. And so if you bring those two sides together and look at it as one common patient journey, you can make that happen.
So when you're here at this conference, who are you trying to meet with? What are you looking to learn about? What are some of the kind of those interfaces look like for you?
Yeah, it's JP Morgan Healthcare Conference has become this pilgrimage that is unprecedented. It blows me away how many people come and congregate here. And it's some of the smartest people in the world in the healthcare industry. So for me, some of it is just meeting new people and hearing what they're working on. Certainly, we're spending a fair amount of time with potential partners. So I've got a portfolio of companies under Health Cloud Capital that all deal with identifying risk signals and data across lab with HC1, medical device with 3Aware, and prescriptions with DecisionRx. And so almost every conversation that I have is relevant to one of those constituents. In fact, last night I met a couple of guys that were here, one from Ireland and one from London, and they were with an international company that focuses on accelerating the launch and sales of new medications and medical devices. And so I've got a couple of companies that could potentially be a partner there. The other part, though, are like these bigger mega trends, like what's going on with reimbursement, and it was fascinating, actually. The Uber driver who I had yesterday, who was a retiree who drives Uber now, and a very smart fellow, and he started asking, he said, why are you guys here? JP Morgan Healthcare. He immediately went right to, well, my healthcare insurance premium just went from $600 to $1,600. So what are you guys doing with my money? And we were like, wait, we're not, in the health insurance space. But that's what ultimately it gets down to, is how much does it cost and what do I get for it?
Mm-hmm.
And so I'm working to get smarter about that. We're doing work in value-based care. We do think the right way for healthcare to trend is to align the incentive with a better outcome. But it's such a massive ball of wax, if you will, that getting smart people around the table to talk about this and learn from them is a big part of the reason I come to the conference.
You mentioned AI earlier. You've been doing this for a while. The nature of kind of what AI is and what AI can do is changing so fast over the last 2 years, 3 years. I mean, longer than that, but yeah. It's accelerating the pace of change. So how does that affect you, and what are you kind of looking to like do better, faster, stronger with these emerging AI systems?
Well, there is definitely a concern with AI as it relates to the possibility of it having hallucinations, or maybe people who are in the workforce being concerned that, oh gosh, is AI going to take my job? I certainly don't think that's where AI is going in healthcare. I think AI is a mechanism to power up every caregiver to the highest possible level of performance. And so there's a concept called reinforcement learning through human feedback, which is this way of integrating together the AI models and the input from the experts, and making sure that those experts are leveraging that to become bionic. And I use that term a bit loosely, but it's a good way to think about it. How do we power up every single caregiver to maximize their time and also ensure that they can spend more time focused on the patient? And so it's not just kind of wading through the fundamental information and having to do a lot of data entry. That's another side of it, is just how do we make it, imagine the patient visit where you can walk into the physician's office. There's already this detailed digital twin of you that's been assessed by the technology that highlights the key areas that might be issues, maybe key things you should screen for more actively, even incorporating things like genomics, because the pace of change and advancement in diagnostics is so fast, no clinician can keep up to speed with that. And I certainly believe in the Hippocratic Oath, and you don't want to be exposing people to harm based on something that's not fully proven and vetted. But with AI, you can get things proven and vetted a lot faster,
Right.
and disseminated a lot faster. So I think this reinforcement learning with human feedback, this combination, this marriage of the technology and insights with smart people, it creates this opportunity to make healthcare much, much better. Now, on the other side of it, though, healthcare is a massive business that requires tons of labor, and it requires tons of supplies and lots of equipment. And so at every single layer, there are opportunities to apply AI to make all of that work better. Even things like identifying where the equipment may need to be replaced in advance of it failing, or the situation where you've got labor imbalances. You can use AI, which we do today at HC1. We have a whole workforce optimization capability that ensures that we're optimally matching the trends between what you're going to need to test for and the results that need to be generated with the staffing levels. So AI isn't just about precision health or genomics. It's really about every single layer of healthcare and how you make all of it better, and you just do more with less. Like if you think about what GDP is, it's the average productivity of an individual times all the people.
Right.
So what's the next big leap that's going to allow us to have this massive leap of GDP in a world that already has really impressive GDP? It's AI.
Any other things really on your mind this year? JP Morgan's always about looking ahead to what's going to happen to the space in 2025. Are any big trends that you're looking at or thinking about?
I think value-based care is going to continue to be a really major emphasis. I think it's even going to be more so with the recent tragic murder of the United Healthcare CEO.
It's really shined a light on.
It's put this huge bright light on this pent up, animosity that's out there, and on the fact that there's just so much pain related to how much these things cost, and it's so opaque in terms of what gets approved and what gets not approved, and which it's so tragic. I can't emphasize that enough. The human tragedy that happened with that. But I think this year we'll see some major steps taken to create that more transparent, frankly, just move everything further to the front end where the patient knows what's going to be approved or not. It's to me, it's this sort of uncertainty and this problem where, it's just this big black box and it's a big guess. And then you get a bill for $80,000 4 months later and you're like, what's this? That just doesn't make sense. So my career started with e-commerce, and we built everything around what the customer needed. And then I moved into healthcare and I said, why is it that nothing's built around what the customer needs? And I think that needs to get addressed. And many people are working on addressing it. It's a complex multivariate problem, but I think making healthcare more friendly to the patient, making it so that the whole payer process is more transparent and more effective is a big trend this year. And then I also think we're going to see more and more actual adoption of AI powered capabilities to help produce more value for patients and for the caregivers.
Awesome. Thanks so much for chatting with me, Brad. This is really interesting stuff. And yeah, I'm always, I think the data side, there's a ton of stuff going on. People aren't always paying as good attention to it, but it's really important in terms of optimizing what we do as a whole industry. So
I think it's the key to everything, frankly. It's about how do you identify these insights from the data and then use that to drive value for everybody across healthcare. And I would be remiss if I didn't mention all of this ultimately accrues to the benefit of pharma companies that know how to partner with and engage with the provider side, again, to benefit patients, but ultimately accelerate the pace at which we can get these new therapies to market. So I think the future is very bright. I generally am a believer of abundance. And I think right now is the time that we're going to see some major leaps. And I think 10 years from now, we'll look back and say, my goodness, can you believe how disconnected healthcare was? You know, and I think it's just going to keep getting better.
awesome. Well, thanks so much. I hope you have a great show.
Yeah, thank you so much. Appreciate it.